You're watching Eagle News America. I'm Anna Queen. If you are a healthcare worker and in Canada, you are required to get vaccinated against COVID-19. To tell us more, joining us tonight is Bureau Chief Thomas Likness.
Thanks, Anna. Well, the associations representing Canada's doctors and nurses say immunization against COVID-19 should be a condition of employment. Now, that call came in a joint statement today from the Canadian Medical Association and the Canadian Nurses Association. Both groups say such a policy would keep patients as well as workers in healthcare settings safe. Medical Association President Dr. Ann Collins says vaccination could be considered a part of the fundamental duty of care toward patients and the public. You know, she says there is significant evidence that vaccines are safe and effective, so why not? Why not? And Collins adds it's healthcare professionals who are leading the vaccination campaign, so mandatory vaccination is the right thing to do. Nurses Association President Tim Guest echoes that view. He says, throughout the pandemic, healthcare workers have been on the front lines and were among the first to roll up their sleeves and get vaccinated. So far, the Canadian government has resisted any suggestions that vaccines be made mandatory. You know, we're expecting a federal election here in the next several weeks. It is going to be called one of these days. And politicians, I'll tell you, when that topic comes up, politicians are going to be running for cover. They don't want to talk about it. But, you know, mandatory vaccinations in healthcare settings, well, that's nothing new. Some hospitals and nursing homes already require staff to get shots for things like tetanus, hepatitis B. So, you know, adding COVID to the list, I don't think is that big a stretch. Several European countries now require people in healthcare to be vaccinated if they want to work. But here, the prevailing attitude seems to be that people have that constitutional right to opt out of immunization. And while that may be true, you got to wonder, do they have a constitutional right to work unprotected, caring for medically vulnerable people? So is making people choose between vaccination and their job unreasonable? Yet another conundrum for the tall foreheads to debate. In Edmonton, Canada, Thomas Likness, Eagle News. We live in interesting times. Back to you, Anna.
Thank you, Thomas, for your report. Yeah, you know, exactly. I mean, the healthcare workers, like you mentioned, they're required to have hepatitis B, and it's only right, I think. Now, we hear a protest against vaccines, against public health restrictions, but I understand in your province there are protests of a different kind. What can you tell us about that?
Yeah, that's right, Anna. This is almost a 180-degree shift in attitude. For 5 consecutive days now, several hundred people in Edmonton and Calgary have been demonstrating against the government's move to remove all restrictions. All of this is going to go into effect in the middle of this month. Alberta will become the first province in the country to no longer require people who test positive for COVID to isolate. People who have come into contact with somebody infected with COVID, they'll no longer have to quarantine. It's advised, but you don't have to. COVID testing will be reduced, and you know, things like masks, well, they've gone the way of the dinosaurs, at least as far as the government is concerned. A lot of people I noticed still wearing them. I was in the bank today, and everybody, staff and customers alike, we're all masked up. Many people say the government is moving too quickly and being reckless, but the government, for its part, says, well, you know, we've got vaccines. COVID is less infectious and less deadly now. We've got these vaccines. So they're treating it like any other seasonal respiratory illness, things like colds, the flu, things like that. Doctors fear this is going to have just terrible results. They say abandoning all health measures will lead to preventable deaths. We've seen what the Delta variant is doing in other parts of the world, but for some reason, the government here seems to think we're immune to that. Anna, you had a story earlier in the broadcast about the alarming increase in cases in the U.S. there. And just before our broadcast, I heard another report. In Florida, more than 11,000 people were admitted to hospital just today for COVID. Many of us here are fearing that Alberta will become Florida North. And we've got 2/3 of our population fully vaccinated right now in Alberta. But, that's a long way off from what our chief public health officer says we need to achieve herd immunity. Dr. Teresa Tam telling us the target should be a minimum of 80%. And again, Alberta's around 65%, so we're a little bit short. So while some are rejoicing about the absence of restrictions, many others are saying it's too soon to revel in our newfound freedom. Anna?
Well, hopefully they will be looking at what's going on in the rest of the world, like you mentioned, with this Delta variant surging in many parts of the world. I mean, it's really difficult to hear, just like we heard about Jen Psaki saying, not again. We cannot go back to lockdowns as we did early on in the pandemic.
Well,
thank you, Thomas.
Okay, thank you. And we'll talk to you, I guess, at the round table.
Yes, we will see you at the end. Always a pleasure to have you on the show. Stick around for our roundtable discussion.